Virology. Viruses are among the smallest infectious agents known to cause disease. They can be transmitted through various routes, including respiratory droplets, fecal-oral contact, sexual contact, trauma or injection, tissue transplantation, arthropod or animal bites, and transplacental transfer from mother to fetus. Viruses consist of two main components, a genetic material and a protein called a capsid. The nucleic acid genome, which may be either DNA or RNA, but never both, contains all the necessary information for infecting a host cell, replicating, and assembling new infective virus particles known as virons. Viruses are called an obligate intracellular parasite. So basically what that means is that they have to live within a host cell. DNA viruses mature in the nucleus of the host cell, and RNA viruses replicate within the cytoplasm of the cell. Viruses are not capable of replication outside of a host cell, so therefore your specimens need to contain cells for them to grow. Patient specimen contains the suspected virus, is inoculated into a tissue culture. So these are usually a liquid tissue culture that have cells in there that are able to allow the viruses to replicate. So this is not a plated on solid agar that we're used to from the other organisms we have talked about already. It can take 1 to 3 weeks for growth. The tissue culture is examined microscopically for what we refer to as a cytopathic effect. So if a cell is infected with a virus, that cell itself will round up, kind of balloon up a little bit, and eventually, because of the multiplication of the virus, it will have cell lysis. So that is CPE, or cytopathic effect, and that is looked at microscopically, so that determines for us if the virus is present or not. So specimen collection for viral testing. So urine is the specimen of choice for cytomegalovirus, or CMV. Detection and should be collected in a sterile container with a volume of 10 to 20 milliliters. Blood specimens for viral testing are collected in heparinized tubes to prevent clotting. Swabs used for viral specimens should have plastic shafts and should be placed immediately into viral transport media to preserve viral viability. Timeliness is critical, and specimens must be transported and processed as soon as possible to ensure accurate results. It is important to read the laboratory orders carefully to help ensure proper handling in testing. Viral cultures may also be accompanied by fluorescent antibody staining for direct viral detection. However, fluorescent antibody staining is a separate procedure and does not replace the culture. Blood specimens for serologic testing should be collected without anticoagulant to allow proper serum separation. After collection, serum must be separated promptly from the cells and either refrigerated or frozen at negative 70 degrees Celsius to preserve antibody integrity. When serologic testing is indicated, 2 serum samples are required: an acute phase sample taken during early illness and a convalescent phase sample collected 10 to 14 days later to detect changes in antibody levels. Stool specimens should be collected as soon as possible after symptom onset, with 2 to 3 teaspoons placed in a sterile container and stored refrigerated or frozen until processing. Urine is the specimen of choice, as mentioned earlier, for CMV or rubella virus. For CMV testing, urine should not be frozen unless 70% sorbitol is added as a cryoprotectant to prevent viral degradation. A lot of times with virology, we are determining antibody levels, and we're not always trying to recover the virus itself. So acute and convalescent, think about your immunology IgM, which comes up first in the immune response. Following a few days or maybe even a couple weeks behind that would be your IgG levels. So at that point, generally your IgM will kind of start to disappear to non-detectable titers, but your IgG will remain. Diagnosis can be based on demonstrating an increase in the antibody titer to the virus or the presence of an IgM antiviral immunoglobulin. Antibodies are typically measured by immunofluorescence or enzyme immunoassay. And what we're looking for is a 4-fold increase in titer between acute, which is that first part of the infection, the IgM, and convalescent, which is that later stage of the infection, which is where the IgG is the only one that's left. If we are doing true cell cultures, remember that viruses are strict intracellular parasites. So the culture, or the cell culture media, has to contain host cells so the viruses will replicate. They need to be incubated from 1 to 4 weeks. We're inspecting them on a regular basis microscopically for the presence of that cytopathic effect in the host cell, because again, that will help us determine if there's multiplication of the virus, if the virus is replicating or not. So examples of your cell lines include primary monkey kidney, HEP2, which is a human epidermoid carcinoma cell, and human diploid fibrocystic cells. And then we have shell vial cell culture. This is a modification of a cell culture. So an infected cell monolayer is stained for viral antigens. The CPE, or the cytopathic effect, then can be detected in 1 to 2 days. The cover slips are contained at the bottom of the culture tubes, so it's a lot less hassle than it is to set up for the CPE, and then it is stained to look for the CPE. Nucleic acid probes are short segments of either the DNA that's designed to hybridize with the DNA or the RNA on the probe. Could be labeled with any type of tag, whether it's fluorescent, chromogenic, or radioactive. So if we have viruses present where we have a DNA and nucleic acid match, then we're going to go there. There will be a signal that will be detected. So once they match up, that's how you'll know that the virus is present or not. When collecting viral specimens, avoid using calcium alginate swabs in those with wooden shaft, as these materials can inhibit viral viability or interfere with testing. Generally, viruses can survive for 24 to 48 hours when stored in a refrigerator. For longer storage periods, specimens should be frozen at -70 degrees Celsius to preserve viral integrity and prevent degradation. Viruses are most likely to be detectable in patient samples during the onset and acute phases of the disease when viral replication is at its peak. In contrast, specific antibodies against the virus become detectable only during the acute, recovery, and convalescent stages of infection as the immune response develops. The viruses covered include herpes simplex virus, cytomegalovirus, adenovirus, enterovirus, rhinovirus, influenza viruses, parainfluenza viruses, respiratory syncytial virus, varicella-zoster virus, rotavirus, Epstein-Barr virus, and last but not least, hantavirus. The herpes virus family includes herpes simplex virus 1, 2, varicella-zoster virus, Epstein-Barr virus, and cytomegalovirus. Among these, herpes simplex virus is the most commonly isolated virus. Herpes simplex virus 2 primarily causes genital herpes and neonatal herpes, which can be transmitted during the birthing process. Herpes simplex virus infections can affect various body sites, including the skin, oral, and genital areas, as well as the central nervous system, where it could cause encephalitis. Transmission occurs through direct contact with infected secretions or autoinoculation. Clinically, herpes simplex virus infections are often categorized based on location. So herpes simplex virus 1 typically causes infections above the waist, such as oral herpes, while herpes simplex virus 2 is usually responsible for infections below the waist, including genital herpes. Primary oral infection with herpes simplex virus 1 often presents as rhinitis, pharyngitis, and tonsillitis. In infants, herpes simplex virus 2 is typically acquired during birth, leading to neonatal herpes. Treatment for herpes simplex virus infections commonly involves the antiviral drug acyclovir. Diagnosis can be made using direct immunofluorescent staining to detect viral antigens. For culture, human diploid fibroblast cell lines are used, where herpes simplex virus infection produces characteristic cytopathic effects confirming the viral presence. Varicella-zoster virus. This is the virus that causes chickenpox in children. And if that virus remains latent for years and is then reactivated in an adult, it can cause shingles. Transmission is droplet or by direct contact, airborne or mucosa of the upper respiratory or conjunctiva. Now we have vaccines, which is an A2 series vaccine for the herpes simplex. They get them as their children. And then there's also a shingles vaccine for adults now as well. For adults, Epstein-Barr virus is associated with the infectious mononucleosis. So Epstein-Barr virus, or EBV, is also responsible for Burkitt's lymphoma. The infection is spread by infected saliva. Serology is typically a test called a monospot test, and it works by detecting a heterophile antibody. In a CBC, if you remember back to your hematology course, you will see atypical or reactive lymphs in your peripheral blood smear. This is usually found in patients who are around college aged, high school, college age, somewhere around there. 33 to 75% of Epstein-Barr virus does manifest as infectious mononucleosis. Symptoms of that include headache, malaise, fatigue, sore throat, pharyngeal inflammation, an enlarged lymph nodes, and an enlarged spleen. So the hepatosplenomegaly, or the enlarged spleen, is what is the big concern in college-aged patients or high school-aged patients, because they could play sports. So generally they will tell them no contact sports, or those types of things, to help try to prevent the spleen from rupturing from those type of activities. Cytomegalovirus, or CMV. This is a congenital and a perinatal infection. It will involve many organs and may cause severe central nervous system involvement. Therefore, it's the leading cause of mental retardation in the United States. The HDF, or the human dermal fibroblast, is your primary host in your cell line if you're using a cell culture to try to isolate or grow CMV. Urine is actually going to be your specimen of choice for this virus. In the neonates, you can do a torch titer. A torch titer will actually test for multiple different viruses, so it'll test for toxoplasma, rubella, cytomegalovirus, and herpes simplex virus. So the torch titer can be used to assess the congenital infections. Adenovirus, it's the primary cause of the common cold, so everyone has probably had this at one point in their life, or maybe even this season already. The mode of transmission is inhalation. Can cause infection of the eyes or upper respiratory and lower respiratory tracts, urinary tract, and gastrointestinal tract as well. However, it is primarily responsible for the respiratory tract infections. You can have a co-infection with Epstein-Barr virus or HIV. It has also increased association with gastroenteritis. So sometimes your specimens can be throat swabs, conjunctival, or feces. Your cell line is usually the human embryonic kidney cells. And again, colds and other types of acute respiratory diseases are going to be associated with adenovirus. And then we have enterovirus. This family of viruses include the poliovirus, Coxsackie and echovirus. These infect and multiply typically in the gastrointestinal tract. Polioviruses are lytic agents, so they cause damage to the central nervous system tissue, and that will result in the paralysis. We haven't had polio in the United States for quite a while, since basically everyone is immunized at this point. So if people stop getting immunized for it, polio could make a comeback. Rhinoviruses are the primary causative agent of the common cold, leading to symptoms such as nasal congestion, sore throat, and sneezing. They are highly contagious and spread through respiratory droplets in direct contact. Influenza virus. All right, so these are spread person to person by airborne droplets or direct contact. Infections most often are influenza A, especially in the fall. Then it starts to switch over to the subtype influenza B in the spring, or like the tail end of the flu season. Ray's syndrome is associated with the flu and aspirin products. And so this is damage to the liver. So that's why we give children acetaminophen, which is Tylenol, not aspirin, which is ibuprofen, when they have flu-like symptoms. We have rapid testing for influenza, but if we were to culture, we would use primary monkey kidney for that cell culture. And then we have parainfluenza virus. This is transmitted by aerosol droplets or direct contact. The cell culture cell line will be primary monkey kidney cells again. Specimens are going to be either throat or nasal. So the differences between the influenza and parainfluenza. So the severity is one of them, the age group, and then the vaccine availability. So severity, the influenza tends to cause more severe symptoms and complications compared to parainfluenza, which is usually milder. Though croup in some small children can be pretty severe, but that is generally caused by parainfluenza. Age group. Parainfluenza is a more common cause of respiratory illness in young children, while influenza will affect essentially everybody, age group. It doesn't discriminate on age. And then you have vaccine availability. So there is a vaccine for influenza, but there is not for parainfluenza. Respiratory syncytial virus, or RSV. This is an important cause of lower respiratory tract illnesses in infants and young children. This causes bronchitis and pneumonia, especially in children who are less than a year old. If you were doing a cell culture, it's going to be primary monkey kidney again. We do have antigen detection tests to try to determine if RSV is present or not, and this will be done as like a rapid type of test. Specimens include secretions of the nose, oropharynx, nasopharynx. Aspirates are also going to be considered your best choice of specimen. And last but not least is the hantavirus. So hantavirus causes hantavirus pulmonary syndrome. Symptoms include hemorrhagic fever, myalgia, headache, cough, pulmonary interstitial infiltration, and kidney disease. Hantavirus is transmitted by infected deer mice, which shed the virus in their saliva, urine, or feces. Humans are infected by the hantavirus by inhalation of aerosolized virus particles from the feces of the mouse. It can also be transmitted by direct inoculation into the mucous membranes or by broken skin, such as when an infected animal would bite you. Treatment is generally supportive therapy. So most of these patients are severely sick. They will oftentimes end up in the ICU, and then they will do supportive therapy in there. So like getting some fluid off the lungs, things like that. For other lab data, normally you'll see a decrease in platelet count, a left shift in your CBC differential, and greatly elevated liver enzymes, about 2 to 5 times that of upper limits of the normal range.